I'd like to begin by acknowledging all Aboriginal and Torres Strait Islander traditional custodians of country and recognising their continuing connection to land, sea, culture and community. I acknowledge Wurundjeri Woi-wurrung people of the Kulin Nation as the traditional owners of the land on which I reside. I pay my respects to elders past, present and emerging. My name is Monique Davey. I have been a secondary school teacher for the past 30 years. Very rarely did I ever think about domestic violence when interacting with students. But I did recognise students who were not coping one way or another with life. And until this course, I think I may have exacerbated their trauma due to my own ignorance. Today, I want to talk about trauma-informed practices within schools across Australia to address current trauma in students who are suffering domestic violence at home. This presentation will consider the primary and secondary school age at-risk population. I will highlight symptomatic behaviour across this cohort, the likely future for these students, and the most common types of domestic family violence that they experience. I will reveal some of the major roadblocks that currently stand in the way of progressively shifting towards trauma-informed teaching practices and care. These include lack of policies, protocol and professional learning. I will finish with realistic and practical recommendations for schools and education departments to move in the direction of creating trauma-informed practices to provide refuge, recovery and healing for students suffering trauma across Australia due to domestic family violence. Domestic family violence can include control, both physical and mentally, sexual assault, emotional and financial abuse, and stalking and surveillance through technology. It impacts the mental and emotional health and well-being of a child, which may lead to lifelong mental health issues as the cognitive functioning of the developing brain is stunted due to prolonged trauma. Piecing together fragmented government-issued data, we find that 1 in 7 adults report being victim to child abuse, and 1 in 4 women since the age of 15 have experienced family domestic violence. It is reasonable then to infer that every school across Australia does or will accommodate children who are suffering domestic family violence. Home life for students suffering trauma due to domestic violence can be volatile, unpredictable and unsafe, the effects of which, broadly speaking, include fear, anxiety, depression and hopelessness. This can carry over from home to school, affecting learning, relationships, social and emotional progress at a time of crucial development. There is little research of trauma-informed practices in school settings for children suffering trauma due to domestic family violence, simply because domestic family violence is a silent and hidden abuse. It does not mean, though, that it is non-existent. In 2023, there were just over 4 million children enrolled in schools across Australia, accounting for over 1/6 of the Australian population. As a subset of the broader population, this diverse group represents every race, religion, gender, socio-economic, minority and majority group from the ages of 5 to 18. It is crucial to note that domestic family violence knows no boundaries. Students in primary school tend to display signs of clinginess, have higher school absences, are unable to concentrate, appear tired or withdrawn. They may have low self-esteem or display hypervigilance. Students in secondary school tend to display riskier behaviour, which includes self-harm, eating disorders, suicidal ideations, substance misuse and criminal behaviour. In the classroom, the more obvious signs can be bullying, either perpetrator or victim, antisocial behaviour, anxiety, depression or disengagement. Recognising victims of domestic family abuse remains a challenge in schools for 2 main reasons. Firstly, School staff are not equipped to recognise the nuances of trauma in children. And secondly, victims, both parents and children, are reluctant to disclose abuse. As a result, children suffering trauma are often mislabelled by school staff as overly sensitive, defiant, problematic, learning challenged, or aloof. This ignorance belies a work environment that is not associated with domestic violence, creating a resistance to introducing trauma-informed practices. A major barrier to schools becoming trauma-informed providers is the lack of literature in strategic frameworks, practices, and support systems for implementation. School staff are currently mandated to report abuse that is disclosed or evident to them, such as burn marks. However, staff are not equipped with the skills of recognising the nuances of domestic violence, where children build resilience rather than compliance or defiance. Schools have wellbeing policies in place. However, these align with cultural expectations or societal norms. Domestic family violence is not a normal cultural experience, and the lack of awareness and education amongst staff promote the culture of "not my problem" when faced with the issues such as disengagement, anxiety, and depression in children if they are still meeting learning outcomes or can be redirected to a school counsellor. Punitive measures for misbehaviour still prevail in schools across the country as teaching staff do not recognise distressed or trauma behaviour. By educating staff to see the benefits of trauma-informed practices to improve student behaviour, a fundamental driver for cultural change can begin. In a perspective that may seem radical, the healthy cultural environment fostered by trauma-informed practices has the potential to initiate not only a significant cultural shift within schools, but could also extend its impact into homes across Australia, potentially reducing the prevalence of domestic family violence. The organisational recommendations are as follows. Culture. Creating community-wide awareness of trauma response behaviours in children suffering trauma due to domestic violence. This includes staff training, student awareness, and parent education. The unique position of a school is its ability to liaise with both parents and students and should not be underestimated in creating expectations that students will be placed at the centre of the wellness equation. Education departments, principals, and school leaders to embrace trauma-informed practices and pedagogy, ensuring that all staff are supported during and after this transition from current teaching practices. With the right ongoing support, the system is likely to enhance teaching styles, countering the effects of dysregulated behaviour due to domestic violence. Policy. Mandatory ongoing professional development in trauma-informed practices for staff. As research evolves and better practices emerge, school staff need to be proactive in best practices. This, over time, will ensure up-to-date best care for students. Creating clear guidelines for trauma-informed practices for each school that is submitted for approval by state education departments. As each school faces their own unique challenges based on age group and demographics, all levels of staff in school, from office staff to teachers, will need to know their roles and responsibilities, from engagement with students to mandatory reporting. This will enable students from different demographics, such as refugees or Indigenous groups, to have trauma-informed practices that cater to their unique needs. Practices. Transitioning from punitive consequences for behaviour to managing challenging behaviour through trauma-informed practices of safety and dialogue. Training in trauma practices will enable school staff to recognise trauma-related behaviour and shift the paradigm from trauma-compounded early learning school leavers to better skilled, resilient children. Reassessing pedagogy to build resilient children who take responsibility for their own choices and behaviours. This can be implemented through the balance of empowerment with setting healthy limitations. Expectations, routines, consequences, facing challenges, and restrictive practices can then foster engagement, respect, validation, voice and choice, and support. At present, there is no data on the number of Australians perpetrating domestic family violence. The adult population with mental illness, substance abuse, chronic health issues, and trauma display a strong correlation to childhood domestic abuse. Without targeted studies, victims of child abuse only emerge years later when the damage is done and the cycle of abuse is already established. Children born into a home where domestic violence is occurring grow up with an unhealthy exposure to trauma-inducing events. The lack of study, intervention, and strategies to help these children stems from domestic family violence occurring behind closed doors. Trauma-informed practices in both primary and secondary schools provide a genuine safe refuge for children who are victim to domestic family violence, regardless of them being identified or not. Without these practices, re-traumatisation through lack of awareness creates a compounding effect on these children. Current and future generations require skilled school staff who work with a new pedagogy, staff who are provided training, supported in their role allocation, and where clear guidelines are policy-driven from education departments to principals to teachers. Ongoing professional development, government and industry-wide support are essential if we are to break the domestic family violence cycle and give voice, refuge and healing to the child victims of domestic violence.